Dr. K. Good morning, Dr. K.
Good morning, Jack.
How are you this morning, sir?
Doing pretty good this morning.
Dr. Kevin Kavanagh, he is a retired physician from Somerset, Kentucky, and is also the founder of a national becoming international organization called Health Watch USA. What is that exactly?
Well, we're a nonprofit research group and also a patient advocacy group. We've specialized in advocating for low-cost healthcare and also high-quality healthcare. And we've really been concentrating the last couple years on COVID-19 because unfortunately that's impacting both. And recently, as you know, we've had a conference of nationally renowned experts from around the world. And Jack, I think it was very beneficial. I wish we could get a lot of people on to our website, healthconference.org, to view some of the presentations because we are headed into the winter and we may have another surge with COVID.
That's what they're talking. That I assume has to do with being inside in the winter months.
That's correct. That will augment spread of the virus. And we also see that sometimes during the summer months in the southern states where people are inside because of the hot weather. They tend to have surges at that time. And there's also some worrying variants which are over in Europe. And we're currently seeing a surge starting to occur in some of the European countries and the United Kingdom. In the United Kingdom, hospitalizations are up some 37%.
Wow, that's pretty significant. Talk about the new bivalent booster shot.
Well, this I think is really key to ward off the new variants coming. And the idea here is to keep your immunity as high as possible. And this shot has both the original variant in it, which came from Wuhan, China, and also the BA.5 variant. A lot of the new variants are actually subvariants of BA.5. And I'll be honest with you, Jack, there's so many variants now, you just can't keep track of them. They're popping up all over the place. And this booster, if people in the United States would adopt it, has the potential of averting some 90,000 deaths and 936,000 hospitalizations with a savings of $56 billion. And these are estimates from the Commonwealth Fund. If the booster isn't widely adopted and we just continue on as we're currently doing, it doesn't look that good. We could reach up to 1,200 deaths per day. Right now, on average, 27% of the population has had a booster. If you look at people who are over the age of 50, only 36% have had their second booster. And Jack, I've had 3. My third booster was the bivalent. And you'll only get the bivalent with the booster. You do not get that with your standard 2-dose vaccine. That's still the original variant. So if you're not vaccinated, you will then have to go through 2 doses of the vaccine and then get the bivalent booster, which I think will give you the best protection against the BA.5 variant. There are other variants out there which are worrisome. There's a Q11 variant, which is in Canada and the United Kingdom. And this has been estimated to having the highest ability to escape vaccine-induced immunity. It is, however, a BA.5 variant, and you would expect some crossover. And you also hear about this convergent evolution, where a number of different lineages are taking on similar types of mutations. There's at least 6 mutations people are watching, and a number of these variants are acquiring these 6 immune escape mutations. And so they're called level 6 variants, and people are watching that. But they haven't caused huge surges yet. We just need to watch it. If you can remember about the Mu variant and the Lambda variant, those were very concerning too, but yet those variants weren't the ones that necessarily caused surges in the United States. And so we really have to see what happens, but it does not look good for us having a winter without COVID simply because of what's going on in Europe. And the flu, unfortunately, is also worrisome. Australia has had a rather significant flu season, and so one should also be getting the flu vaccine because it's not COVID or the seasonal flu. Unfortunately, you can get both. Jack, people need to go out and get their flu vaccine. I myself got the COVID booster early on. I did not get the flu vaccine yet. I tend to kind of wait until cases start ticking up and then get that vaccine. The flu vaccine only lasts for several months. It's not long lasting. So I tend to want to time it with the surges of the seasonal flu. With the flu, it tends to go away during the summer. Unfortunately, with COVID, it tends to persist during the summer. So it does have some seasonality, but not to the degree that the flu has.
My understanding is there is a new, stronger flu shot for those over 65 this year, too.
That's correct. And I always get that one. Unfortunately, I'm in the group of people that are higher risk, and it's essentially an increased dosage of the flu shot. That's one of the reasons why I tend to go for the Moderna booster, because it has a higher dosage than the Pfizer booster. And with really young children or children in the teenage years that are getting the adult booster, some people will advocate getting the Pfizer booster for that group of individuals.
I also understand that you can get both of those vaccines, both the COVID and the flu, at the same time. You may end up with a sore arm and feeling a little under the weather for a day, but it's not going to hurt you.
That's correct. You can get it at the same time. That is recommended. So certainly if you want to get it over at one time and get your shots done so you don't have to worry about getting another shot, go on ahead and get them at the same time. They are both covered by Medicare, private insurers. Right now, the boosters are still free, and so I would certainly suggest going out and getting those. And also, up till the 13th, we're just 3 days away from that, you should be able to still order free COVID tests on your insurance. For Medicare, that's 8 free tests per person per month. That program is set to run out this month, and so I would suggest that people go to their pharmacies. I went to Walmart, ordered those. I know Walgreens does the same thing. You just say, I have Medicare, give them your Medicare information. They put in a charge. If it's accepted, which mine have been, they'll give you 8 free tests, which are 4 boxes. So I think that that's something people should do.
Dr. Kevin Kavanagh, thank you very much.
All right. Thank you, Jack.